Under a certain age, we're told to do everything to catch problems early. After 60, the message often becomes louder, not smarter. More scans, more blood work, more appointments, just in case. But more isn't always better. In 2025, the wisest men I see are asking sharper questions before saying yes to a test, because every test has a cost: time, money, anxiety, false alarms, and sometimes procedures you didn't need. Tonight, I want to help you separate what's truly protective from what's merely habitual. I'm Dr. Linda Parker, your urology guide, and I'll walk you through 7 tests many men 60+ should pause and question. Not automatically refuse, but question, so you can make decisions with clarity and confidence. Let's start with the most emotionally loaded topic in men's health: the prostate. You've heard it. Just get a PSA every year, no matter what. That sounds safe, but it isn't a one-size-fits-all rule after 60. The PSA blood test can be valuable when used with judgment, your personal risk, and a plan for what you'd do with the result. It can also become a treadmill of follow-ups you never wanted if it's ordered without context. Here's the problem. PSA is a signal, not a verdict. Many benign conditions, enlargement with age, inflammation, even a long bike ride, can nudge the number up. When that happens, anxiety spikes. Retesting begins, sometimes biopsies follow, and you may find yourself chasing a tiny risk while ignoring the big, fixable threats to your longevity, like blood pressure, sleep, muscle loss, and glucose control. If you're 60 to 70, in good health, and you value early detection, PSA with shared decision-making may still make sense. If you're older, have limited life expectancy, or you know beforehand you would not pursue treatment for a low-risk finding, the same test may add more harm than help. The smarter question isn't PSA, yes or no. It's, given my age, my family history, my goals, and my general health, what would I actually do with a borderline result? If you and your clinician can't answer that, the test is premature. Ask for a conversation first, a test second. Now step outside the prostate for a moment and into the world of colon screening. I see men booked for annual colonoscopies as if it were a dental cleaning. That's not how screening works. A normal, high-quality colonoscopy generally buys you a long interval before the next look. If you had small, low-risk polyps removed, the interval is shorter, but still measured in years, not months. Unnecessary early repeats add sedation risks, prep fatigue, time away from life, and cost, without a matching gain in protection. If you've reached an age or health status where the risks of a repeat procedure outweigh the benefits, or if you had a clean exam recently, you're allowed to ask, why this year? And, what's my evidence-based interval based on my last findings? If your previous exam wasn't complete, or the prep was poor, that's different. Completing a proper look is valuable. But repeating just because it's what we always do isn't a plan. Precision beats habit. Next is something men almost never question because it sounds so heart-smart: the routine cardiac stress test or treadmill ECG in someone with no chest symptoms and average risk. If you feel well, walk daily without limitations, and your overall risk is modest, blanket stress testing doesn't reliably add years to your life. What often follows a mildly abnormal screening result is a cascade of imaging and procedures, each with their own risks, for a problem you might never have felt. If you have symptoms, chest pressure on climbs, shortness of breath out of proportion to effort, unexplained fatigue, or you have a high calculated risk, testing is a different conversation. The key question is, what is my baseline cardiovascular risk, and how would test results change my management? If results won't change your plan because you're already committed to exercise, blood pressure control, lipid management, and healthy nutrition, then testing becomes curiosity rather than care. Curiosity can be costly. Fourth on my list is the carotid artery ultrasound in men with no symptoms and no specific findings on exam. A carotid scan looks for plaque in the neck arteries that feed the brain. It has a place when you have neurologic symptoms, a bruit on exam, or a particular risk pattern. But a screening scan, just to see, creates a playground for false positives. And here's the trap. Once you find a little plaque in a person with no symptoms, it's very hard not to escalate. Procedures on carotid arteries carry risks. We reserve them for situations where the benefits are clear. For most older men who feel well, the smartest brain protection happens at the kitchen table, on the sidewalk, and in the weight room. Pressure control, glucose control, lipid control, walking, and strength training. Ask, why me, why now, and what would we do differently if this shows a little plaque? If the answer is, we'd keep doing what you're already doing, then you already know which side of the scale is heavier. Number 5 is the shiny, tech-seductive world of whole-body scans and indiscriminate imaging. A just-to-be-safe full-body CT or MRI often finds harmless anomalies with scary names. Those findings spark serial scans, needle biopsies, even surgeries, for things that were never destined to harm you. Imaging is a powerful tool when you have a symptom, a red flag, or a clear clinical question. Without that, it's like fishing in a crowded lake with dynamite. You'll pull up something, but you may not like what it makes you do next. A cousin of this is the coronary calcium CT used indiscriminately. Calcium scoring can be useful in men with intermediate cardiac risk because it helps decide how aggressive to be with prevention. But if your risk is already high enough that you should be on treatment, or low enough that you wouldn't change anything, the score becomes trivia with radiation attached. Ask, will this scan change my actions? If not, protect your time and your peace of mind. Sixth is a blood test that has exploded in popularity because it promises vitality in a vial. Routine testosterone panels in men without symptoms. If you have low mood, low energy, poor sleep, central weight gain, less strength, and decreased desire, it's reasonable to evaluate hormones, but in context. Many of those issues improve when you lift twice per week, walk daily, sleep deeply, eat protein and fiber, moderate alcohol, and address medications that sap energy. When men skip those foundations and go straight to a lab, they risk labeling a life problem as a lab problem. Worse, once you're on testosterone without a clear indication, you inherit a monitoring plan and potential side effects. If you're truly symptomatic, have repeat morning levels drawn with good technique, and check the basics at the same time. Thyroid, iron, glucose control, sleep quality. Ask, what non-prescription corrections will we try first, and how will we remeasure? Men who anchor to habits first often find the number follows the life. Seventh is the grab bag of routine lab panels and tumor markers sold as cancer screening for healthy men. A scattering of tumor markers drawn without symptoms can raise red herrings that lead nowhere good. Meanwhile, truly useful labs get ignored because they're not marketed with fear or flash. If you want blood work that buys you protection, prioritize the boring champions. Blood pressure measured well, fasting lipids, markers of glucose control, kidney function, and in the right context, a one-time abdominal aortic aneurysm ultrasound if you ever smoked. These unsexy checks prevent strokes, heart attacks, kidney failure, and ruptures, events that change families, not just numbers. Ask, is this test proven to help men like me live longer or better, or is it just an early alarm for alarm's sake? Your time deserves an honest answer. By now you've noticed a pattern. I'm not asking you to reject medicine. I'm asking you to practice it with intention. Before any test, invite 4 questions into the room. What problem are we trying to solve? How will a positive, negative, or indeterminate result change my next step? What are the downsides, false positives, radiation, anxiety, procedures? And, compared with this test, where's the biggest, most fixable risk in my life right now? Most men 60 plus extend both lifespan and health span, not by collecting test results, but by stacking the fundamentals that move every system in the right direction. If you want a simple filter, use this. Don't let a test replace the habit that actually treats the risk. You can't scan your way out of weak legs, but you can squat, hinge, push, and pull your way into a steadier gait, a safer fall, and a healthier metabolism. You can't blood draw your way out of a diet that spikes your glucose, but you can fill half your plate with vegetables, make protein a backbone, and treat processed sugar as a guest, not a roommate. You can't image your way out of loneliness, but you can build the kind of friendships and routines that anchor your nervous system. When those pillars are in place, the tests you do choose become sharper and fewer, because you're only asking them to answer questions your habits can't. Let me give you 3 short portraits of what this looks like in real life. Ramon is 62, walks 25 minutes daily, does simple strength work twice a week, and cooks at home. He felt great and was booked for a treadmill stress test because everyone in the office is doing it. He asked, "What would we do differently if it's borderline?" His risk turned out to be low, his plan wouldn't change, and he chose to skip the test this year and keep investing in the habits that drove his risk down in the first place. He bought back a morning of his life and kept his focus on actions, not alarms. Elias is 69, with a history of small, low-risk colon polyps removed 5 years ago. An annual colonoscopy had crept into his calendar like a tradition. When he asked for his personalized interval based on the last findings and the quality of the prep, he discovered he'd been going in 2 years too early, every year. He synchronized with an evidence-based schedule and used the extra time to rebuild muscle with a trainer, noting better balance and fewer nighttime bathroom trips, benefits no scope could deliver. Hector is 73, a retired teacher with an old fear of the big C. He bought a direct-to-consumer panel full of tumor markers. One number came back slightly high, leading to a month of sleepless nights and repeat tests that eventually showed nothing. He now keeps his screening strategy simple. Stay current on the basics that change outcomes, personalize decisions like PSA and colon screening with his clinician, and protect his mental health by declining tests that only search for trouble without a clear plan. Let's circle back to the prostate for a practical, calm approach you can use this year. If you're considering a PSA, write down your personal values first. Are you the kind of man who wants to know early and would be willing to pursue biopsies and, if necessary, treatment? Or do you value minimizing procedures in the absence of symptoms, especially if your overall health is already compromised? Share that with your clinician. Align expectations. If you decide to screen, ask about strategies that reduce overreaction to borderline results, like repeating the test under standardized conditions, considering the trend over time, and pairing the number with a careful exam and risk profile. If you decide not to screen right now, replace it with action. Walking, strength, sleep, nutrition, and weight management quietly reduce the very risks that reveal themselves later as numbers. There's a quiet superpower in the word why. It makes healthcare a partnership. When someone schedules a scan just to check, it is both reasonable and wise to ask, why me? Why now? What would we do differently with each possible result? What are the immediate downsides, and what are my big, modifiable risks that we should address first? No clinician worth your trust will be offended. In fact, the best welcome the question because it means you're here to live, not to collect tests. If everything I've said tonight could be distilled into a single line, it would be this. At 60 and beyond, the test that matters most is the one that changes what you do tomorrow. If a test won't change your next step, question it. If a habit will change your next decade, choose it. You didn't come this far to spend your time in waiting rooms. You came this far to walk the beach at sunrise, to lift your grandchild with steady hands, to laugh at dinner with a heart that keeps good time, and to feel at home in your own skin. That's what wise testing protects. The life you're living, not the fear you're avoiding. If this helped you think more clearly about your decisions, share it with a friend who needs permission to ask better questions. Tell me in the comments which test you plan to revisit and which habit you'll double down on this month. If you want more calm, science-backed guides for men's health after 60, subscribe and stay close. I'm Dr. Linda Parker, and I'll see you in the next one. Disclaimer: this video is for general educational purposes only and is not a substitute for personalized medical advice, diagnosis, or treatment. Do not start, change, or stop any medication or screening plan without discussing it with a licensed healthcare professional who knows your medical history and risk factors.